The WHO is in the crosshairs right now. Look, big picture, I think there's nothing wrong with it. You have to have a critical awareness of the relationship of international institutions with their primary donor states. So there's no doubt that the WHO is going to try to be attentive to Chinese interests. It's going to be threatened by the United States. There's no like magical outside of politics institution, sad to say. At the same time, the WHO is obviously an important part of the global coordination in response to this crisis. And they have at times correctly debunked administration fear-mongering about China and dishonesty about the nature of this virus. And what is Mike Pompeo, who wants to use this opportunity to accelerate economic warfare with Iran? Caribbean leaders are resisting the stationing of warships in the Caribbean Ocean, which not only it's primarily to threaten Venezuela, but it's also, I think, a signal to places like Grenada and Trinidad and Tobago to not mess around with oil production right now and not do anything with their production levels as Russia and Saudi bring down oil markets. But anyways, being that as it may, this is Mike Pompeo saying the Trump administration might have a plan for how to deal with the WHO not embracing the Chinese virus terminology.
Just say we held.
At this point, we're reevaluating our funding with respect to the World Health Organization. This is very consistent with what President Trump said since the beginning of his campaign. Organizations have to work. They have to deliver the outcomes for which they were intended. And we need to make sure that not only the World Health Organization, but every international organization, that we take taxpayer money and give it to them for the benefit of America. We need to make sure it's delivering on those taxpayer dollars. The World Health Organization is no different in that respect. They have to execute on the mission that they are designed to achieve. And we've seen, with respect to the World Health Organization, here we are. It hasn't accomplished what it was intended to deliver.
The problem in the United States is that the Trump administration is allowing companies to price gouge to this day. It has not mobilized national resources, and it has undermined state efforts. They have announced today that federal support for testing sites is going to be drawn back. Literally, the WHO has nothing to do with that one way or another, frankly.
Yeah, didn't they try to give us tests and we said no?
No, because we want our own.
Exactly.
The anger is that, and we don't, and by the way, and this is I'll just say this really quick. This is another really key point. We want our own is going to get conflated with a very important point that, of course, we need independent national and local supply chains. Every country, every municipality should have the capacity to produce its own essential medical services. That's really important. We cannot allow nationalists to steal that. That is actually an incredibly important principle for everybody.
Not for capitalist reasons, but for purely practical ones.
But what they're doing is crony capitalism and using that terminology to cover their crony capitalism. And that's another really important thing to watch. Anyways, guys, go ahead.
No, I'm just curious, like what do you say when you say every locality needs to be able to produce? Sure, masks and hospital gowns, whatever. But pharma, like where are the limits here? I feel like that's a very broad statement.
Well, I mean, I don't understand. What would you be concerned about with that? I mean, why shouldn't, as an example? I mean, we were already seeing that. Look, if California can come together and bring its purchasing power and have an alliance of NGOs to source. Yeah, they can source in Asia, but I also don't see any reason why. Like in LA right now, I mean, this is also like a version of the Defense Production Act. In LA right now, there's an enormous garment district and production. Why can't the government be mobilized in such a way to produce generic pharmaceuticals.
Because there's no infrastructure for that. That's like saying,
build. Well, but we need
in Arizona,
we need to build that infrastructure.
New
That's
Mexico,
the point. But that's what people like Holly are proposing. And if we sit on our asses with that and say it's not there, that's going to be another major argument that they're going to win, because this is going to be a thing we're going to see internationally right now. China
don't even
does
produce
this
in the U.S. right now, let alone in every single municipality.
That needs
I think
change.
Politically, we have to sit here and say what's actually doable in the next 10 years, and what do we prioritize? And setting up pharmaceutical. I'm sorry.
Oh no, that's definitely
that's like pipe dream in my mind.
In 10 years, what are you talking about?
In 10 years, you're saying yes. The pharmaceutical industry, the way it's structured right now, it's completely impossible.
That could be restructured very quickly. Yeah. Look at how China's done it in that level speed. Unless you think they have like special magical abilities we don't have, which they don't. This is
they don't have a democracy. I'm saying based on the political, institution right now and the way that money flows into certain states. Absolutely. I mean, follow how New Jersey structures their pharmaceutical industry bills right now. The way that pharma, works in the trade industry. Go to Puerto Rico.
That.
Puerto Rico is the headquarters for pharma globally.
Yes.
And I understand. I'm not arguing with you about big ideas and bold ideas and going hyper local. I'm saying we have to understand specifically what our capacities are right now. Right now we need to build those.
But the argument,
without a doubt,
are you saying that the primary obstacles are political, and that's why it's like politically impossible? Because I agree with that.
Yeah. I think that we have to be realistic and say in the next 10 years with gerrymandering, what are our top priorities?
If we're being just politically realistic, we're not going to achieve anything in 10 years. Then the point of this is the thing. It's like, if we want to just do what is achievable in 10 years on a current trajectory, then okay, here's what maybe we can slightly improve unemployment. Maybe certain states will have some type of public health care option. That's about it.
That's not what I'm saying. I'm saying using the power that we have right now with leverage, right? So the fight for Medicare for all right now, we've been fighting this for, arguably at this level for the last 4 years with the help of the national nurses, really getting into the ear of Bernie Sanders and working hand in hand with him.
Bernie Sanders, pretty much.
No, it's the national nurses. You go back in that history.
No, I understand. No. I understand what you're saying.
I'm sorry. I'm just saying we got to give them credit because they are a militant union. I mean, they operate in a different way than most unions do. So you have, maybe 2 or 3 left-leaning democratized unions in this country among the weakened unions that we have. We are likely to have even more control over Republican legislatures because of gerrymandering that's going to happen after this year and the census. And so that's 10 years moving forward. What I'm saying is we have the ability to present bold ideas, but to throw out 9,000 bold ideas, some of which are going to require flipping this country over in an idealistic.
No, but what you're missing, it's not. No. This is a really, really important point you're missing. These ideas are literally getting introduced right now by people like Josh Hawley. They are getting written and formulated as policy. Right. So it is in fact a open terrain that they're capitalizing on. Mm-hmm. And not only is the right policy, but if we don't have answers and proposals on, it will be a major area of potential political failure. So it's the opposite of idealistic. Yeah. It's opportunistic and strategic to look where they're getting ground. And it's also, at the end of the day, because I'm sorry, events like this are only going to increase with things like climate change. It is a strategic question. So look, might it not get achieved? Of course not. But Medicare for all very likely might not get achieved. Like, there is nothing. That's what I'm trying to say. There is. Well, okay, that's true.
I'm not being an increment. I'm actually not being an incrementalist. I want to be very clear about that.
Everything's an uphill battle. Everything's an uphill battle.
I understand that. I'm not saying this is an incremental approach. I'm literally just trying to say we have to have we've had this conversation, Michael. We have to real understanding of what leverage we have in this moment and how we use it and where we use it. And so this specific moment moving forward, and in 5 years, we might be in a different situation because we've won this moment. But I see us in a situation politically where we're recycling the same tactics over and over again. And very much so, after 2016. I mean, I can't tell you how many groups I was on a call, like I just said, where we're having the same conversations we had in 2016 as leftist groups, because leftist groups don't unite. They don't have a real, agenda.
I guess, I mean, I totally buy it. It just it doesn't have much to do with what I'm talking about.
But you're saying hyper local. You're saying every single state, every single community should be able to produce their
absolutely. That should totally.
Water is being privatized. I mean, we have to have a real. I'm trying to give a wake up call. There are cities that they're bankrupted right now. They can't even keep their lights on. And we're saying, we are now going to be in a situation where localities, which in most of these states are completely Republican controlled, and they will be for the next 10 years because of gerrymandering, because the Democrats fucked everything up. Excuse my language. Sorry, I'm on YouTube. So we have to say, okay, using the leverage we have right now.
Well, but again, this doesn't make any. All right, we'll get off in a second, but it just doesn't make any sense, because the areas I'm talking about are areas where there actually is policy opening with parts of Republicans. That
pharmaceuticals. Since when?
Look at what Josh Hawley's proposing. Look at what they're talking about. That's what I don't agree with
it. I think it's wrong.
But they're talking, okay, well, I guess then we disagree. I do think there should be an attempt to bring some resiliency into the system and with supply chains. I think that's actually
I agree with the supply chain. I'm saying the pharmaceutical thing is a pipe dream. It is disconnected from the reality of the political world that we live in. And if we're going to fight battles, we have to decide, how are we going to be strategic? How are we going to use our power right now and achieve success, and in 5 years and in 10 years? And the pharmaceutical industry owns 85% of our government right now.
Well, right. Yeah, sure. But by the same token, but again, so Medicare for all is not going to happen. Like,
no. Medicare for all is tremendously popular. The pharmaceutical industry flipping over on its back is we would have to put all of our energy into that and ignore 90% of the other issues that are much more crucial at this moment in time.
Well, the pharmaceutical industry is also incredibly unpopular. Like, I've been reading a lot in Commune Mag about how, I think there was an article about how the conditions for mass revolt and revolution are closer certainly than they were a few months ago, certainly than we've ever thought they were within our lifetimes. Unemployment is at an unprecedented level. We're seeing all of these people who were previously considered kind of disposable workers. Now we're seeing how essential they are, and they're recognizing their own power. So, they were writing this with an eye towards world revolution, because that's what they care about. And that's the thing I care about the most as well. However, I think these same conditions could also bring about more short-term changes on the legislative level. If we, I don't want to be too pessimistic about.
Can I just be really specific here? Like, Josh Hawley has the Medical Supply Chain Security Act, which has support in the House from Mark Pocan. The coronavirus outbreak in China has outlined severe and longstanding weaknesses in our medical supply chain.
Sure.
This is more than unfortunate. It's a danger to our public health. Blah, 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 blah. Then there's a bunch of stuff about, Chinese production. If it's in the right wing, it's going to get used in that frame. This has support from Pocan. This is an obvious, mind-blowingly obvious area to capitalize and collaborate on, and is precisely realistic because, number one, there actually is some momentum for it in both political quarters. The things you're talking about with cities, like privatizing water in cities, is a longstanding Republican and Democratic project, and it is primarily about targeting the poor. And we already know, that is a longstanding political dynamic that's going to require enormous amount of organizing and is really important. I agree with you, Miki, but that has nothing to do with Josh Hawley's season opening, which is both we need to actually do, because this is a question of health and security, and it's only going to get more so as these things continue with climate change and other pandemics. And also politically, I don't want to be in a position where Josh Hawley is the main vehicle of such important policy changes that will reverse some of the bad effects of PNTR. That's it. It's not, I don't think
I don't, it's not that I disagree. And I want to make this very clear. It's not that I disagree with Josh Hawley's, act in dealing with the supply chain issues that we face because of the trade deals of the 70s through today. With that being said, getting a little bit more micro-focused on the pharmaceutical industry specifically, I think that's where we have to be very realistic. We have to break down,
Well, he's talking about life-saving drugs and medical devices. So even so that does include pharmaceuticals.
But we have to get out of New York and go to like communities right now that aren't even able to keep their lights on. And do you think that the political power? No, but it's the truth.
There's no contradiction, and there's plenty of people in New York that can't keep the light on. I get what you're saying.
No. I mean, the communities, the cities cannot keep their light on.
I understand, but it just
actual governance.
Totally, but it just doesn't. Yes, but that has nothing to do with what I'm talking about.
Yes, it does. How are you you're going to be able to facilitate production specifically in these communities? You're saying totally decentralized, not state by state. I'm talking about every single city.
No, it obviously would start state by state. Anyways, this is a really important area, and they're going to capitalize on it if we don't. That's all. And of course, there can be longer term ambitions about these things, and we need to balance those immediate tasks and longer term ambitions. But this is happening immediately. This is Tucker content. This is a bill. Right. This is happening now. So, I just don't want us to be lost on it as we usually seem to be.
We should be very wary of ever letting the Republicans get to the left of the Democrats on economic issues. Like, I don't think they're actually going to do that. I think it's primarily in the form of rhetoric. But, give them time. Like, on the one hand, I guess it's kind of good that they're not actually realigning into a traditional fascist party yet, except for rhetorically. On the other hand, it's bad because they're totally botching this response and people are suffering.
And by the way, I mean, if they want, look, Brazil did an incredible projects with Mozambique, which is one of the poorest countries in the world, where they assembled generic drug factories from the ground up very quickly with not a huge amount of investment. Like, this stuff, we do need to start embracing and looking at those ideas. And it's obviously in conjunction with clean water and people's lights and things like that, obviously. But I think if this is in the menu of what Republicans are talking about, there's an opportunity to do something. And then there's also the incredible danger of letting them get ahead of us on it. Whereas, unfortunately, I think fighting for electricity and water for people who are already in communities that are devastated and undermined by capital, that's the long-term struggle regardless. And I will not expect to see any work from that from Republicans or most Democrats, frankly. Setting up production with some upsides in terms of jobs, some pandemic preparedness. Yes, I do think that there is some energy in that direction, and we need to capitalize on it. All right, let's do